Hi everybody, Dr. Ahles here. In this short video, we're going to talk about the three main kinds of lung cancer and what it looks like with each stage. The reason I'm making a video specifically about lung cancer is because this is actually the leading kind of cancer death in North America. So as much as we hear a lot about things like breast cancer or prostate cancer, lung cancer is actually the most deadly of the kinds of cancers that we deal with right now in the medical field. There are three different kinds of lung cancers that are different based on what kinds of cells they develop from. So the first kind of lung cancer is what we call adenocarcinoma. When we talk about adenocarcinoma, this is a kind of lung cancer that starts either in those simple squamous alveolar cells or in our type 2 alveolar cells, the glandular cells. So if we start in the epithelial cells down in the lung itself, we call this adenocarcinoma. This is the most common kind of lung cancer, making up almost half of all lung cancers that we see. The second most common kind of lung cancer is called squamous cell carcinoma. Squamous cell carcinoma develops a little bit higher up the respiratory tract, so lining the bronchial tubes themselves as opposed to inside the alveoli, we can develop cancerous cells in these locations. Obviously, if we're growing tumors inside a bronchial tube, that tube is no longer going to be able to pass as much air down into the lungs. That would dramatically impact gas exchange ability. The least common kind of lung cancer, but as a type that is still a possibility, is called small cell carcinoma. When we talk about small cell carcinoma, this actually develops up quite high in the respiratory tract if we're considering these locations. The primary bronchi are the two tubes, remember, that go into each of the lungs. So if the epithelial cells from that part of the respiratory tract become cancerous, we call that small cell carcinoma. Now, with any of these types of carcinomas, any of these cancers, early detection is critical to treatment. So the sooner we can detect that there is a mass of incorrect cells developing inside the lungs, the better our treatment odds are. When we stage lung cancer, along with any of our other cancers, it ranges from stage 1 to stage 4. So when we talk about a stage 1 lung cancer, this is going to be a type of cancer that is confined specifically to one lobe of a lung or even one segment, a smaller section of that. If those cancerous cells spread out into the nearby lymph nodes that are found in the lungs, we would call that a stage 2 cancer. It's started to metastasize, or it's started to spread. By stage 3 cancers, either we will see metastasis into other lobes of the lung, or we might actually see metastasis of this cancer from one lung to the other lung. So either way, we've moved beyond the initial point where the cancerous cells developed. We've spread, again, either throughout a single side of the lung, a left or right lung, across to the alternate side as well. A stage 4 lung cancer would include metastasis or spreading to distant locations in the body. The most common locations for a lung cancer to spread are into the brain. The blood vessels of the brain are lined with very similar tissue to the kinds of cells that are found in the respiratory tract, so they'll often spread here. The liver is another location where lung cancers will often spread. We will also see spreading to places like the bones or the adrenal glands. Big idea with lung cancer: different kinds of respiratory cells can turn cancerous, and depending on how far those respiratory cells have traveled in the body, that gives me an idea of which stage of cancer I'm dealing with.